Hello everyone and welcome back to Medinos Medicos. The topic that we're going to deal today is about clavicle from bones anatomy. So I have selected this topic because it is very vital in first year MBBS during university exams because you would be asked viva. You would have the osteology viva during which you would be given bones and you have to explain about the bones, the sides to the external examiner or the internal examiner who would be taking your viva. Also, it is important in forensic medicine in tanthology for the side identification. If you find any remains in the remains of the dead body while burn cases or from graveyards for an existing case that we need to do and many more. So we just go to the overview without any further ado. We would be dealing with the introduction, the site determination, peculiarities, attachments, clinical anatomy, what is cleidocranial dysostosis, and we would be also having a bit of a small brain teaser or a question for you, not a brain teaser, a question that you need to solve on your own. So what is clavicle? Clavicle actually is a long bone which has two ends. One is the lateral end and the other is the medial end. Now the lateral end would always be 1/3 and the medial end is 2/3 of the clavicle bones if we divide it into three portions. So this is I have written this over here, but I would be explaining it in the image. So I have put this over in the PPT so that if you want you can note it down for yourself. Now for the side determination, as I said, lateral is always 1/3 of the clavicle portion and medial would be always the 2/3. Now I will be helping you how to identify this. When you're given a bone, the first thing you should understand to know, realize what is the lateral and the medial side. So lateral would always be the edge portion. Edge portion means the outward portion is known as the lateral side and the medial side would always be the inner portion. So by this you would understand always that the medial portion should be facing inwards. That makes the medial side 2/3 would be always facing to the uh, manubrium sterns to form the sternoclavicular joint. So this would be passing through the midline of your body. That is if you see the midline of the body in a sense like the place where this rib bones come and attach the manubrium. And now when we see the lateral end, you would be seeing that it is flattened over here, flattened at the end, which is flattened from above downwards position. And then if you see properly, you would be having an inferior surface groove. The groove name is known as the subclavian groove, and this is present over here. And then you would be seeing that the anterior border would be having a would be concave forwards, while the posterior border would always have convex backwards. So if the bone is tilted in forward direction, so this bone given over here is actually right side clavicle bone. So if this is given in this way, the posterior would be above and the anterior would be below. But if it is given in the opposite direction, if you have held the bone in the opposite direction, your anterior would be above and the posterior would be below. Okay, so now there is also a ridge present over here. The ridge, if you see over here at the lateral end, in between the acromial end, from there you get a ridge starting over here. This is the trapezoid line or the ridge, and it have an end facet which attaches to the which articulates over the acromion process and forms the acromioclavicular joint. And then you would be seeing another tubercle that is a the inferior surface. It is an elevation. This tubercle is known as the conoid tubercle. Now same way, when we go for the medial surface, what you will be seeing is that the shaft is always curved slightly. It is a it's slightly curved so that it is always convex forwards. When you see the end over here, you would be seeing it as round, and it is said to have four surfaces, and this is large and quadrilateral in um, shape. When we go for the features, you would be seeing that the anterior surface would always be convex forwards, the posterior surface would be smooth, while the superior surface over here would be rough in the medial part. and then you would be seeing that the inferior surface over here would be having an oval impression. This portion over here would be having an oval impression at the medial ends, and if you see over here also, you would be seeing some impressions that is oval. So as I said, this would go and form the what, sternoclavicular joints. Next, so this is what I have explained to you. This is what I was saying about the sternoclavicular joint. So this would be attaching over here to the manubrium. Now, what are the peculiarities? So this is the bone. It is the only bone that lies horizontal to our and it is subcutaneous all throughout. It has an it starts ossifying early, and it also ossifies its membrane. So there are two primary centers of ossification, which is very important. You need to tell this in your viva. These are the two primary centers. Among this, the one primary center would be arriving at 5th to 7th week, and this fuses by the 45th week, 45th day. And these two, I'm talking about these two primary centers. Now we have a secondary center in this sternal end. So this secondary center, it arrives when we turn into 15 to 17 years, and it fuses by 21 to 22 years, and it is the only bone that does not have a medullary cavity. There is also something that happens over here, is it is occasionally you might see that it is pierced by middle supraclavicular nerve, and it receives weight from the coracoclavicular ligament that is at the lateral one third end, and it transmits weight to the axial skeleton by the medial two third end by from the upper limb region. Now when we go for the attachments, we might see that the lateral end, I have told already when during the site determination that the lateral end would form the acromioclavicular joint. This joint over here, if you see, when it goes and attaches over here, they would be forming a joint capsule. Now when we go for the medial end, you would be finding that this articular surface for the sternum, they would give attachments to the fibrous capsule of sternoclavicular joint all around. They would be forming posterior superiorly articular disc. When you go for the intraclavicular ligament, superiorly you will be seeing an intraclavicular ligament. When we go for lateral one third of the shaft, you would be seeing that the origin of the deltoid muscle is the anterior border. As I said over here, the anterior border would be the deltoid muscle. You would be seeing an insertion of the trapezius muscle as the posterior border. Then you would be seeing the coracoclavicular ligament, you would be seeing that conoid tubercle and the trapezoid ridge, they would be giving two attachments of at the trapezoid as well as the conoid parts, that is this portion and this portion too would be giving an attachment. Then when we go for the medial two third of the shaft, you would be seeing that the anterior surface has pectoralis major covering. uh, Pectoralis major, as I said over here, anterior surface would be giving a pectoralis major portion. Then you would be seeing that the rough surface of the rough superior surface would be giving costoclavicular ligament, that is this portion over here. Then you would be having subclavian groove, that is which gives rise to the subclavian muscle over here. Then you would be seeing that the margin of the subclavian groove would be giving rise to clavipectoral fossa. Then you would be seeing that the posterior surface would be giving rise to sternohyoid muscle, that is over here. And then you would be seeing that the subclavian vessels and the divisions of the trunks of the brachial plexus, they would be lying between the inferior surface of the clavicle and the upper surface of the first rib. Also we need to know another thing is that this subclavius muscle, it acts as a cushion for it. If you see over here, this is how it would be looking. Now what is the clinical anatomy? So one is indirect violence. So if you see over here, this boy's uh, clavicle has been in different place in this formation. So when the x-ray was taken, you could see that there was a breakage. So this sort of fracture occurs when when a patient, or when a man or woman, when an individual, they fall on an outstretched hand, and because this the junction between the curvature of the bone, as I said, the junction between the two curvatures of this bone is the weakest point, and that's why it is the most commonest site for the fracture to occur. So what happens is, over here, what happens now is, when this lateral fragment it gets displaced downwards by the weight of the limb, as trapezius muscles is alone unable to support the weight of the upper limb, and so this formation has come. Now we'll be learning about cleidocranial dysostosis. In this, what happens is, the clavicle is congenitally absent, so there would be a shoulder droop as seen over here. And when you see an X-ray, you won't be seeing any clavicle over here. And this can be approximated anteriorly in front of the chest, like it is not going to go posterior, it would be always facing forwards. Now I would have to ask you the question that which side do you think this bone is, and how did you understand it? So the answer, I would like to expect you to drop the answers in the comment box, and then I'll be pinning up my comment at the top. I hope you understood clavicle very well, and this was the video for today. I hope you like this video. If you like this video, don't forget to like, share and subscribe to the channel. Also, we'll be coming with more videos. Till then, stay tuned and happy learning. This is Ashna Viraju signing off for today. Bye.